Anorexia nervosa literally means loss of appetite for nervous reasons. It is characterized by weight loss. However, anorexia nervosa sufferers have not lost their appetite. They have lost weight because they are suppressing their urge to eat. Most anorexia sufferers cannot easily dismiss the feeling that they are fat or at risk of becoming fat if they fail to keep their eating in control. Such feelings are usually quite independent of their actual weight. This is referred to as having a distorted body image. Anorexia nervosa is one of the most serious disorders afflicting children and adolescents, with the potential for serious impact on both physical and psychological development. Anorexia nervosa typically begins in adolescence, with onset by age 20 in over 85% of patients, and rarely develops after 40 years of age. Mortality is high. Approximately 10% of chronic anorectics die from complications of malnutrition and electrolyte abnormalities, and another 5% die from suicide. This disorder is 10 times more prevalent in women than in men. There is also a strong cultural component. Anorexia nervosa is more common in Western post-industrialized nations, and, in the United States, whites are more affected than African Americans or Hispanic Americans. While the culture of thinness in which we live is certainly an influential factor in the development of anorexia nervosa, it is by no means the sole cause. Anorexia is a response to a complex mix of cultural, social, familial, psychological, and biological influences unique to each person. Some possibilities are discussed below. One widely accepted theory is that people develop anorexia because they seek control over themselves and their lives. Food and weight can be controlled when other aspects of life cannot. Restricting food intake in the presence of enticing foods evokes feelings of accomplishment. A high percentage of people struggling with anorexia have a history of abuse, neglect, or other traumatic experiences, and develop anorexia as a coping mechanism. Losing weight provides a concrete goal that requires time, energy, planning, and effort. Therefore, anorexia nervosa becomes an effective way to cope with difficult circumstances because it serves to distract the sufferer from the pain. It has been suggested that anorexia nervosa sufferers come from families who are very close emotionally, which can make it difficult for them to develop a sense of their own individuality and independence. The following two features seem to be characteristic of many sufferers. First, most have low self-esteem. The second feature is that they find it difficult to deal openly with problematic emotions. This may have something to do with their personality type. They may tend to be perfectionists who obsess over things. In general, eating disorders seem to arise in the midst of the difficult business of growing up and developing as a person. Though no candidate gene has been identified for the disorder, data from family and twin studies suggest hereditary factors. Anorexia nervosa has a concordance rate of nearly 70% for identical twins and 20% for non-identical twins. First-degree relatives of anorectics are more likely to be anorexic. In order to get better from an eating disorder, the first task is for the sufferer to regain a sustainable and healthy body weight and pattern of eating. This involves the person giving up undue eating restraint. In practice, this involves eating regular meals of sufficient size. Carbohydrates may be especially important in restoring appropriate regulation of eating. Most people who find themselves with anorexia nervosa have very mixed feelings. On the one hand, they hate their present state; on the other, they fear changing it because change may seem to threaten instability and a loss of control. The sufferer is caught up in a vicious circle, and the easiest thing to do in a vicious circle is to stay within it. Breaking out is always demanding. It requires courage and faith. The core treatment for anorexia nervosa should involve some kind of psychotherapy which enables the patient to feel safe enough to change.